Tokuda from Hawaii for 5 minutes of questions.
Thank you, Mr. Chair, and I hope I'll have an additional 30 seconds like the previous gentleman. And Dr. Fauci,
I have allowed that today on several occasions.
Thank you, Mr. Chair. Dr. Fauci, you deserve better than this. The other side suddenly cares about puppies, ironic given recent book publications, versus the millions of people that you have kept safe and alive over your lifelong commitment to public health. I'd like to use my time to dispel some of the myths about you that have circulated in right-wing circles. We can all acknowledge that, yes, suspension of in-person activities during the early days of COVID, it was necessary to save lives and to stop the spread, and it was not without its challenges. It was difficult, particularly for our nation's students, like my two sons in public schools, and our business owners. But to completely blame these policies on you, Dr. Fauci, is absolutely ridiculous. I'd like to make the record clear on something. The decision to suspend in-person learning, dining, and other activities, that was not a decision that you were somehow solely responsible for, including in your role as NIAID director. Is that correct? In fact, these decisions were actually made at the state and local level in communities across the country, like my home state of Hawaii, which was particularly aggressive, in part as a response to the Trump administration's early failure to contain the initial outbreak of the virus. Is that not correct?
I'm sorry, I didn't, ma'am, I'm not really hearing you very well. Could you just put your...
We'll put it a little bit closer, but to be clear that the decisions were actually made at the state and local levels in communities across the country.
That is correct.
Okay, thank you. Now I'd like to shift topics and turn to the allegation that you sought to suppress opposing viewpoints about the pandemic response. Over the past 15 months, majority members of this subcommittee have levied the allegation that federal health officials censored proposals like the Great Barrington Declaration, which were inconsistent with the overwhelming consensus of the scientific and medical community. Much attention has been paid to an email Dr. Francis Collins sent you regarding the Great Barrington Declaration, where he called for a quick and devastating published takedown of its premises. To be clear, this was not Dr. Collins suggesting that you suppress or censor the Great Barrington Declaration. Rather, he was suggesting that the points you just explained be memorialized to substantively refute the scientific premises of the Great Barrington Declaration. Is that correct?
Yes.
And there was good reason for Dr. Collins to have substantive concerns. The Great Barrington Declaration proposed lifting mitigation measures for the vast majority of society and preserving them only for certain populations, including the elderly and people with underlying health conditions. This was months before a vaccination was available, and public health systems were already being overwhelmed, and thousands of Americans were dying daily. Dr. Fauci, what percentage of the population did we estimate needed to be infected with COVID before we would achieve so-called herd immunity?
Herd immunity was very elusive with COVID, and the Great Barrington Declaration was flawed both conceptually and in practice. Conceptually, that you could shield vulnerable people as if the only vulnerable people are those in nursing homes. We have tens and tens of millions of vulnerable people that you couldn't possibly shield. People with underlying conditions, the elderly, those would be the individuals. So it would be conceptually impossible to do that. Herd immunity, as we know, means if you have a virus that doesn't change and a virus in which when you get infected or vaccinated, you have highly durable, perhaps lifelong immunity. That's not the case with COVID. We know immunity wanes and we have multiple variants. So in practical purposes, the Great Barrington Declaration was invalid, both conceptually and practically.
Thank you, Dr. Fauci. You've answered a few of my other questions in terms of the fact that for many of us that live in multi-generational communities, thousands, hundreds of thousands, millions more lives would have been impacted by this so-called approach. And given the fact that the virus's rapid evolution that we have seen since 2020, herd immunity approaches would be absolutely ineffective against COVID. If you would answer one more question, considering the mortality rates at the time, how many more deaths might we have seen, just briefly?
I mean, if we had done that, just let it rip, there very likely would have been another 1 million people would have died, I would imagine.
Thank you, Dr. Fauci. So it wasn't the federal government suppressing the Great Barrington Declaration. Rather, it was about protecting and saving millions of American lives. The COVID-19 pandemic wasn't some academic exercise. It was real. It was in real time. It was about saving lives in real time. Theories like herd immunity may seem plausible on paper, but we have to remember that it is based upon the assumption that enough people would have to be infected. And that would likely have meant that our family members, our friends, our neighbors, our constituents, especially those in our most marginalized, multi-generational rural communities, would have died. So thank you, Dr. Fauci. I want to thank you, not blame you. Thank you for your science. Thank you for your science that have saved millions of American lives, kept us safe, including my children, many of our families right here on this dais. And thank you for clarifying these points for the record and for all of your efforts to keep us safe during the pandemic and so many other health crises we have faced over the decades that you have served. Mahalo, Mr. Chair, and I yield back.
Now recognize Dr. McCormick for 5 minutes of questions.